Hey guys, it's Doc Heps here with UroCoach. So a lot of patients come in, they ask me their urinary symptoms are changing, they're worried that something dangerous or bad is going on. Well, in this video, I'll talk about what's dangerous, what you should look out for, and what's normal. We'll also talk about some natural supplements and natural ways to improve your overall urinary tract and prostate health. So stay tuned. Hi guys, it's Doc Heps. So a very common reason that men come in and see the urologist, see me, is that their urinary symptoms are changing and they just want to know, is there something bad going on? Or is this change, their new symptoms that are evolving, normal? Well, this is very common. And we're going to talk about what's normal and what to look out for. We're also going to talk about some natural ways to improve your urinary tract health. So make sure you subscribe, like, comment. We love to hear from you and we appreciate your time. So let's get into it. So what symptoms are normal? Well, as we age, the bladder and prostate changes. Typically, the prostate will enlarge. This is a natural occurrence, and some men genetically are programmed to have a larger prostate and others smaller. Other men have a small prostate that might be narrowed or tight, whereas some men have a big prostate and it really doesn't cause problems at all. Some of the symptoms that enlarged prostate causes are weak stream, frequency, urgency, a sense that you don't empty completely, maybe getting up at night, and dribbling. Now, many men experience these symptoms to a certain or lesser effect, and it kind of depends on the day. The most consistent thing about prostate and urinary symptoms as we age is its inconsistency. I tell that to all my patients that come in wondering, hey, are these symptoms normal? One day is better than the other. Well, as long as these symptoms are not bothersome, meaning that they're not affecting your quality of life, you can get a decent night's sleep, you don't worry too much about getting to the bathroom, or you're not handcuffed to your house and to the toilet wherever you go. These symptoms, to a certain extent, are very common and normal. The things to look out for, the things that are potentially dangerous and they need further evaluation, are if you're straining or really having to push to empty your bladder out, if you're having burning or pain when you urinate consistently, or if you have blood in the urine. Those three things are important components that we need to further evaluate and get further testing. Also, the quality of life component is important. So if you feel like you're handcuffed to the bathroom, you can't do the things you want to do, you're leaking significantly and it's causing problems with your quality of life, where you want to go, what you want to do, it's important that you come in and get evaluated. Now, what would that evaluation entail? Typically, it's an exam, a urine test to make sure there's no infection or blood in the urine, and then a PSA blood test. These are easy, non-invasive ways we can generally help to figure out where to start and if any further imaging or any other procedures may be beneficial. Now that we kind of established what's kind of normal and what's abnormal, how can you, as a patient, improve your prostate health and urinary tract health naturally? Well, there are a few things you can do that are just common sense. Number one, don't get fat, eat right, and exercise. It's been shown that folks who are overweight, significantly overweight, have more urinary tract symptoms, have more prostate problems. Exercise and a healthy diet, generally lots of fruits and vegetables, hydration, and watching your overall meat intake have been shown to improve your prostate health and improve your urinary tract symptoms. Now, are there some natural supplements? Sure, there are some natural supplements out there, and some of these are great and they work for a lot of guys. Most of these are based on two premises. One is an anti-inflammatory effect, and the other one is an effect on the enzyme called 5-alpha reductase, which inhibits the conversion of testosterone to dihydrotestosterone. Testosterone stimulates growth of the prostate, and dihydrotestosterone is up to 10 times more potent than testosterone. So some natural substances like saw palmetto and pumpkin seed have something called beta-sitosterol in them. And this tends to inhibit that conversion of testosterone to dihydrotestosterone. And it's thought that slows prostate growth, potentially making the prostate smaller and overall improving your urinary symptoms. What can you do? Well, from a boots to ground standpoint, you want to maintain a good weight. Don't get too heavy. Eat lots of fruits and vegetables, specifically tomatoes have a lot of lycopene in them, and that is thought to have maybe an anti-inflammatory effect on the prostate and improve overall prostate health. Specific vegetables are cruciferous vegetables, and these are Brussels sprouts, cauliflower, broccoli, and cabbage. Those are thought to enhance and improve overall prostate and urinary tract health. And lastly, things like pumpkin seed or saw palmetto, which has a concentrated version of beta-sitosterol, which is thought to inhibit the conversion of that testosterone to dihydrotestosterone and overall improve your prostate health. Make sure you check us out at realurology.com. I appreciate your time.